my name is Esmeralda Camacho and I'm an occupational therapy assistant student at Mountain View College. And today we're going to perform a manual muscle test. And the reason is because we're going to measure the strain of your muscles on your upper extremities. Do you have any pain today?
No.
Have you had any injury or surgery before?
No.
Okay, so we are going to start with the manual muscle test. Now we're going to measure scapular elevation. Go ahead and raise your shoulder up. Now go ahead and raise your shoulder up again. The manual muscle test result was at 5, which is normal. Now we're going to do elevation of the scapula in gravity minimized. So please go ahead and bring both of your shoulders toward your head. The result for this is at 2, which is poor. Now we're going to measure scapular depression. So go ahead and place your hand 30 degrees. Go ahead and raise your arm, keep it straight and raise it up towards your ear. Okay. Now go ahead and keep your arm straight and raise it up at the ear level. 1, 2, 3. The result for this is at 5, which is normal. A scapular depression and gravity minimized. So please go ahead and extend your arm at 130 degrees, which is around here. Go ahead and keep your arm straight and bring it at your ear level. Okay. The result for this is at 2, which is poor. Now we're going to do a protection of the scapula. So please go ahead and keep your arm straight and bring it towards your chest. Okay. Now go ahead and try to reach the ceiling. Okay. Now go ahead and try to reach the ceiling again. Okay, the result is at 5, which is normal. Now we're going to do a scapular protection. So we're gonna go ahead and place one arm on the table, just one arm. Okay. Now you're gonna go ahead and slide your arm, keep it straight, and slide your arm towards the front. Okay, the result for this is at 2, which is poor. We're gonna do measure shoulder flexion. So please bring your arms to the side and then keeping your arms straight, go ahead and bring it to the front. Okay. Now keep it that way and you're gonna try to bring it up. 1, 2, 3. Okay. This is against gravity and the result is, now we're gonna do a shoulder flexion with gravity minimized. So please keep your arm straight. Go ahead and bend your arm up and down. And the result for this is a 2, which is poor. Now we're gonna do a shoulder extension. So please keep your arm straight and bring it to the back. Okay. Now go ahead and bring your arm to the back. Okay. I can keep it that way. I keep count of 3. You're gonna try to reach back. 1, 2, 3. The result for this is at 5, which is normal. Now we're gonna do a shoulder extension with gravity minimized. So please keep your body straight as well as your legs. And you're gonna bring your arm to the back with keeping your arm straight. Go ahead and do it. Okay. You can relax, you can do it again. Okay, and the result for this shoulder extension with gravity minimized is a 2, which is poor. Now we're gonna measure shoulder abduction. So keep your arm straight and you are gonna bring it to your side. Go ahead and do it. Okay. Now we're gonna resist, okay? At the count of 3, you are gonna try to bring your arm up. 1, 2, 3. Okay, the result for this, for shoulder abduction is at 5. Now we're gonna do a shoulder abduction and gravity minimize. So keeping your arm straight, you're gonna bring it up. Okay, go ahead and put it down. The result for this is a 2, which is poor. Now we're gonna do a shoulder horizontal abduction. So go ahead and bring your elbow up. You're gonna try to reach the ceiling again with your elbow. 1, 2, 3. Okay, the result for this is at 5. Now we're gonna do shoulder horizontal abduction and gravity minimize. So please go ahead and bring your elbow back and forward. The result for this is a 2, which is, now we're gonna do a shoulder horizontal abduction. So go ahead and bring your elbow to 90 degrees. Now you're gonna bring your elbow toward your chest. One more time. Keep it that way. Resist count of 3. 1, 2, 3. The result of this movement is at 5, which means it's normal. Now we're gonna do a shoulder horizontal abduction. So keeping your elbow flexed, you're gonna bring your arm and your hand towards your chest. The result for this is a 2, which is, now we're gonna do a shoulder internal rotation. So go ahead and bring your elbow back. Okay. Now I will resist at 3. 1. Try to bring your elbow back. 1, 2, 3. The result of this. Now we're gonna do a shoulder internal rotation with gravity minimized. So please go ahead and bring your elbow at 90 degrees to your side. Go ahead and bring, without moving your elbow, you're gonna bring your hand inward. Okay? The result for this is 2, which is poor. Now we're gonna do a shoulder external rotation. So go ahead and bring your elbow up. Okay? Bring your elbow up again. Go ahead and bring your elbow up. The result for this is 5. Now we're gonna do a shoulder external rotation with gravity minimized. So go ahead and bring your elbow flexed to your side. Now go ahead and bring, keeping your arm straight, move your hand up. Okay. The result for this is a 2, which is poor. Now we're gonna measure elbow flexion in gravity maximize. So please go ahead and keep your arm straight, and you're gonna bend your elbow towards you. Okay. Now at count of 3, you're gonna try to resist. 1, 2, 3.
The result for this is 5.
Now we're gonna do a elbow flexion, gravity minimize. So go ahead and keep your arms straight. You're gonna bring your elbow towards your chest. Okay. Now do it again. Okay. The result for this is 2, which is poor. Now we're gonna do elbow extension. So please go ahead and keep your arms straight. You're gonna bring your elbow towards your shoulder. Go ahead and put it in neutral position. Go ahead and do it again. Bring your elbow. Okay. Now I'll count to 3. I will put resistance. So try to straighten your elbow. 1, 2, 3. The result for this is a 5. Now we're gonna do elbow extension, gravity minimize. So you're gonna go and bend your elbow toward your chest. Your hand toward your chest. Go ahead and do it. And the result for this is a 2, which is poor. Now we're gonna measure forearm supination. So please go ahead and bring your elbow to an 90-degree angle and keep it on neutral position. Go ahead and bring your palm up. Go back to neutral position. Go ahead and bring your palm up. The result for this is 5, which is normal. Now we're gonna do a forearm supination in gravity minimize. So go ahead and bring your elbow to an 90-degree angle, and you're gonna move your thumb towards outward in this position. Okay, go ahead and do it. The result for this is 2, which is poor. Now we're gonna do a forearm pronation. So go ahead and bring your elbow to 90 degrees angle and keep it in the neutral, and you're gonna move your arm, bringing the palm down like this. So do the movement. Okay, now keep the neutral position and try to bring your palm down. 1, 2, 3. The result for this is 5, which is normal. Now we're gonna do forearm pronation, gravity minimize. Go ahead and bring your hand up, and you're gonna move your wrist to outward, this position. Okay, keep it neutral. Go ahead and bring your hand outward. The result for this is 2, which is poor.